Hi, my name is Mahi Krishnam, and I'm presenting on kidney cancer with Chavi, Himera, and Natasha. So here's a general description. Kidney cancer is essentially a type of cancer that develops in the kidneys, the organs responsible for filtering waste products and blood and producing urine. There are multiple kinds of kidney cancer, some being renal cell carcinoma, RCC. This is the most type of common kidney cancer found, which makes up almost 90% of the cases. This will be a common cancer we'll see throughout these mutations. A Wilms tumor is a rare type of tumor that primarily affects children, which is not really shown in adults. A sarcoma is a rare type of tumor that originates in the connective tissue of the kidney itself. So essentially, kidney cancer is an overgrowth of tumor cells in kidney tissue. So what makes up a normal cell and what makes up a cancerous cell? Normal cell division, it has controlled growth, apoptosis takes place, normal cells have checkpoints and regulators, and they stop growing once they're in contact with other non-mutated cells. Although since cancer cell division can cause uncontrolled growth, meaning that it won't stop growing, it'll keep mutating. Apoptosis doesn't take place, so programmed cell death does not take place, and these cells will just stay there and live until something intervenes. It doesn't stop growing even if the cells are touching. So even if the cells are touching, they'll kind of just build off on top of each other like a pile. There's defects in the checkpoints and regulators, such as the G2 one, which could cause DNA mutations and such. These are immature and undifferentiated cancerous cells. So differentiation is essentially when the cell is almost assigned a purpose. For example, liver cells, they have a specific purpose. Your kidney cells, they have a specific purpose of filtering out urine and other toxins. And a cancerous cell doesn't have that purpose, so it just grows there and keeps growing and growing. And the main thing about it is that cancerous cells can evade the immune system. So our Cancer Atlas data, we researched 3 genes, the VHL1, the PBRM1 gene, and the TTN gene. So the impact the VHL mutation has on cell cycle and apoptosis is that loss of VHL function can lead to the apoptotic pathway disruptions. So it could lead to increased cell survival and potentially promoting tumor growth. These mutations can lead to uncontrolled cell division and promoting tumor development. Missense mutations are common within this gene, which is the main cause of most of these tumors. The next gene is PBRM1. The way it affects cell cycle is that a loss in this gene can lead to defects in the DNA and damage the G2 and mitosis checkpoint, leading to increased DNA damage and inflammatory signaling. In addition, PBRM1 deficiency can sensitize renal cancer cells, as mentioned before, to D and MT inhibitors like FDCYD, which induces apoptosis and cell cycle arrest, which basically stops and kills the cell itself. And a frameshift mutation in the BRCA1 associated protein can increase risk of cancer developing. Fun fact, less than 100 families in this world have this kind of mutation, making it very rare. The next gene is TTN. This mutation is essentially to further apoptosis and disrupt the cell
cycle. It can also cause mutations in the TTN gene and can cause dominant tendinopathy, which is a genetic disorder that affects the heart and skeletal muscles. Let's move on to the causes of kidney cancer. The specific cause for kidney cancer is actually unknown, but so far what we do know is that kidney cancer is generally caused by mutations in the DNA, making the cells to start uncontrollably dividing. Both genetic and environmental components can cause kidney cancer. Renal cancer predisposing genes consist of VHL, MET, FLCN, and more. And it's known that 5 to 8% of kidney cancer cases are hereditary. Now, some risk factors, external risk factors, include smoking as well as exposure to chemicals. Now, some genetic components include advanced kidney disease or family history, von Hippel-Lindau disease, Birt-Hogg-Dubé or BHD syndrome, Cowden syndrome, and tuberous sclerosis. Now, for the global distribution on this map, you can see that some of the main, top 5 countries with the most recorded cases for kidney cancer as of 2022 is number 1, China, number 2, the United States, number 3, Russia, number 4, Japan, and number 5, Germany. Now, some reasons for the increase in cases of kidney cancer can be rising obesity rates in countries like China, Russia, Japan, and Germany, as well as an increase in smoking in all 5 of these countries. And specifically in Russia and Germany, pollution or contamination or just exposure to chemicals in general can cause an increase in kidney cancer.
Symptoms. Kidney cancer often presents with no symptoms or very few in the early stages. However, some of the symptoms in later stages are hematuria, blood in your urine. The most common symptom of kidney cancer is blood in the urine, which can appear pink, dark red, or brown. 2. Unexplained weight loss. A lot of significant weight loss without changes in your diet or exercise can be a warning symptom. 3. Swelling in your legs or ankles. Kidney cancer can sometimes block your blood flow or lymphatic drainage, leading to fluid buildup in your legs or ankles. 4. Anemia. Kidney cancer can sometimes interfere with your kidney's ability to produce enough of a hormone called erythropoietin, which helps make red blood cells. This can lead to anemia, causing fatigue, weakness, and pale skin. Can the disorder be fatal? Yes, kidney cancer can be fatal, especially if not found in the early stages and spreads to other parts of your body. In contrast, if found in the early stages, it can be treated. It's more likely to not be fatal when the cancer is small and hasn't spread. Methods used to screen for the disease. Screening for the disease is usually only done in high-risk patients. Some of the methods used to screen include ultrasound. This is usually the first imaging test used to detect abnormalities in the kidney when kidney cancer is first suspected. 2. Urine analysis. A urine analysis, which involves testing a sample of urine, can detect the presence of blood or other abnormalities. Kidney function test. Blood tests such as creatine and blood urea nitrogen, BUN. Levels are often measured to assess how well the kidneys are functioning.
Screening and treatment. So the first screening option is advanced MRI and CT imaging. This can be used to determine if this tumor is cancerous or not, the size and stage of any tumors, if the cancer has spread to other body parts, and this can help decide if surgery is really necessary for the person. Next, another method of screening is digital 3D kidney modeling, and it is used to plan a surgery. It helps the surgeon know the tumor's location in the kidney, and it can be paired with an image and intraoperative view from the robot's console for guidance during surgery, since there's a robot that can be used during surgery. Medicine and treatment. So a medicine called axitinib stops cell division in the G2 phase or the M phase of the cell cycle, and it can be prescribed to patients with kidney cancer. Nephrectomy is a surgery that removes either a part of the kidney or the entire kidney depending on the condition and how far it has progressed in the individual. A clinical trial called the anti-angiogenesis agent AG013736 in patients with metastatic renal cell carcinoma. It was open to all sexes, 18 plus years of age, no healthy volunteers, and people that can't take oral medication were invited. So were those who have failed one cytokine-based therapy from disease spreading or treatment-related toxicity. Participants were from all over the United States, and then internationally from France and Germany.